If my prostate is enlarged, it's probably turning into cancer. That's what a huge number of men quietly believe, lying awake worrying after they notice their stream isn't what it used to be. And I want to tell you, plainly and right at the top, that belief is wrong. An enlarged prostate and prostate cancer are two different things, and confusing them causes an enormous amount of unnecessary fear. So I'm going to do something genuinely useful here, and go through the most common myths men believe about these two conditions, and knock them down one by one, until you can actually tell them apart in your own head. Some of what I tell you is going to be the opposite of what you'd expect. In fact, one of the biggest surprises is that the symptoms men panic about are usually the reassuring ones. Stick with me and that'll make sense. One honest thing first. I can't diagnose anyone through a video, and nothing here replaces a real exam. What I can do is clear up the confusion so you stop being frightened by the wrong things. Let's take the big one first, because it's the source of most of the fear. The myth is that an enlarged prostate is an early stage of cancer, or that it slowly becomes cancer over time. Here's the truth. It does not. The common age-related enlargement, the one doctors call benign prostatic hyperplasia, or BPH, is a completely separate condition from prostate cancer. Benign is right there in the name, and it means exactly what it says, not cancer. Having an enlarged prostate does not mean you have cancer. It does not turn into cancer, and it does not mean you're more likely to get cancer. They're two different processes that just happen to occur in the same little gland, often in men of the same age, which is precisely why they get tangled up in people's minds. But one is not a stepping stone to the other. If your doctor tells you that you have BPH, that is not a cancer warning. It's a common, manageable, benign condition. Myth 1. Gone. Here's the myth that traps most men. The idea that you can feel the difference, that cancer would announce itself with worse symptoms, and mild symptoms mean you're safe. The truth is genuinely surprising, so let me explain it with a little bit of anatomy, because once you see it, you'll never forget it. Picture the prostate as a small gland with the urine tube running through the middle of it. The benign enlargement, BPH, tends to grow inward toward the center, so it squeezes that tube and causes symptoms. The weak stream, the frequency, the getting up at night. Those symptoms happen because the growth is pressing on the plumbing. Now here's the twist. Prostate cancer often begins in the outer part of the gland, away from that central tube. So in its early stages, it frequently presses on nothing, blocks nothing, and causes no symptoms at all. None. Do you see what that means? The urinary symptoms men are so frightened of are usually coming from the benign condition. And early cancer, the thing they're actually afraid of, is often completely silent. So you cannot tell them apart by how you feel, and if anything, having urinary symptoms points more toward the harmless one. Feeling nothing is not proof you're fine, and feeling symptoms is not proof you're in danger. Myth 2. Gone, and that one genuinely changes how men should think about this. That leads straight into the next myth, and it's an important one. I feel completely fine, so I don't need to think about prostate cancer at all. We just saw why this is shaky. Because early prostate cancer is so often silent, feeling fine is not, by itself, evidence that all is well. This isn't a reason to panic, remember. Most prostate issues are benign and most prostate cancers are slow. But it is the entire reason that a screening conversation exists in the first place. Since you can't feel early prostate cancer, the only way to look for it before symptoms appear is a deliberate check. And whether that check is right for you is a genuine decision to make with your doctor. I've got a whole separate video on exactly how that PSA screening decision works, both sides of it, so I won't repeat it all here. The point for right now is simply, I feel fine answers a different question than, have I thought about screening? Myth 3. Gone. Now let me knock down the fear itself, because a lot of men treat both of these as catastrophes, and neither deserves that. Take BPH first. It's benign, it's extremely common, and it's very manageable. For many men, it's just a nuisance that lifestyle tweaks help. For others, there are genuinely effective medications and procedures. It is not a threat to your life. In rare cases, if it's severe and ignored for a long time, it can cause complications, which is why you mention it to your doctor rather than suffering in silence. But enlarged prostate is not a disaster. And prostate cancer, the word that scares everyone? Here's the honest reality. Most prostate cancers grow slowly, and when they are found and do need treatment, the outlook for most men is genuinely good. This is one of the more treatable cancers, especially when it's caught early. Many men with low-risk prostate cancer are simply monitored closely rather than rushed into treatment at all. So neither of these conditions deserves the middle-of-the-night terror men often give them. Myth 4. Gone. Now I've spent this whole video calming things down, so let me be responsible and tell you the part that is not a myth. The symptoms that aren't typical of ordinary enlargement, and that genuinely deserve a prompt visit to your doctor. These include blood in your urine or your semen, new bone pain, especially in your lower back, hips, or thighs, unexplained weight loss, or being suddenly unable to urinate at all. These aren't the everyday plumbing symptoms of BPH, and they're worth getting checked without delay. Not to frighten you, I list them precisely so you know where the real line is, and so you can relax about everything on the normal side of it. Knowing the red flags is what lets you stop worrying about the rest. Let me talk plainly to the worry directly for a moment, because I know this topic can sit heavy. For anyone who's been quietly frightened that their bathroom troubles were a sign of something terrible, I hope tonight brings a little more ease. Far more often than not, those symptoms are the benign, manageable condition, the one that isn't a threat to your life. And the way you stay on top of the rest isn't through fear or midnight internet searches. It's the calm, ordinary act of staying in touch with a doctor who knows you and having the screening conversation when it's right for you. That's it. That's the entire job, really. I've knocked down a lot of myths today, so let me leave you with the one belief that's actually worth keeping, the single true thing to hold on to. It's this. An enlarged prostate and prostate cancer are two different things. You cannot tell them apart by how you feel. And that's not a reason to panic. It's simply the reason the checkup and the screening conversation exist. Hold that one idea and you'll never again lie awake turning a weak stream into a death sentence. You'll just know to have the conversation. What's actually happening in your body, only a real exam can settle. This clears the fear. Your doctor does the diagnosing. If this took a bit of weight off your shoulders, a like helps another man find some calm instead of panic. And be honest with me down in the comments. Did you believe an enlarged prostate turned into cancer? You genuinely won't be the only one. Since the obvious next question is whether to get screened at all, I walk through that whole PSA decision, both sides, no pressure either way, in another video. It's waiting for you when you're ready.